मेरे को इतना नहीं दिखता यार। क्या है, क्या हाल, क्या चल रहा है? देख रहे कोई कर रहा है अभी, देख रहे कोई कर रहा है अभी, क्या चल रहा है? देख रहे खुद, देख रहे क्या चल रहा है? अगर ये क्या हो गया? अरे ये क्या हो गया? एकदम ये क्या हो गया? वो ये क्या हो गया? वो ये क्या हो गया? ये कैसे हुआ? अरे ये क्या क्या ये याद में है? कौन है? एक सेकंड, अभी पहले इसे पिक करने को। हाँ, हो गया हो गया हो गया। पता नहीं क्या हो गया था, कोई क्या है? अब ठीक दिख रहा होगा भाई। ये क्या किया था मैंने? दादा याद नहीं है, दादा तो देखा नहीं है, इसलिए दादा याद नहीं है। कोई pulsation of the femoral artery in the inguinal region. तेनल तुम्हारा दादा ही देखा, मुझे याद नहीं है। Pulsations are not any vascular injury to femoral artery following the region. दादा देखा नहीं तुम्हारा, ये वाला चैनल मैंने दादा नहीं देखा है, तो याद नहीं है। Against the head of the femur, which is right between the femoral artery and the head of the femur is dislocated out of the, as it occurs the femoral artery pulsation cannot be okay. Diagnosis or radiograph of the pelvis will clinch. The diagnosis of posterior dislocation of the hip, occasionally CT scan may be required to look for any dislocation fracture of testicle treatment, reduced under the general anesthesia. By the classical Watson-Jones axial traction technique, the limb in the neutral position in fresh dislocation, close reduction may be successful where the old dislocation or in case of the associated fracture with the acetabulum open reduction be more necessary. A large bony fragment of the acetabulum is fixed internally with a plate and screw.
कर रहा है
Dislocation of the hip is a serious injury. The head of the femur slips out of the acetabulum through the capsule according to the direction of the force. The direction of the hip dislocation can be of three types: posterior, anterior, and central. The posterior is most common when the adducted and flexed femur is pushed backward into violent thrust to the knee. When the passenger's knee hits the dashboard of the car, the femoral head is pushed backward, and sometimes it is associated with the acetabular lip fracture. Signs are localized pain, tenderness, attitude of the limb, flexion, adduction, and internal rotation. Flexion, adduction, internal rotation. There are marked shortening of the limb. Limbs of the movement is stable, flexible. Localizing trauma can be present. Femoral head is palpable posteriorly in the gluteal region.
तो दो राइट करो ना
Position of the femoral artery in the guinal region may either be diminished or absent. The diminished femoral position are not due to the vascular injury or femoral artery, but due to the following reasons: abnormal femoral position apparent in the guinal region against the head of the femur, which is right posterior to the femoral artery, and therefore when the head of the femur is dislocated out of the acetabulum, the femoral position cannot be found well. Radiogram of the pelvis with both hip will clinch the diagnosis of the position of the hip. Occasionally, CT scan may be required to look for any sign of when reduction becomes necessary, the blade is proved period of immobilization of the force of open reduction is 6 weeks, and the limb is immobilized either in the form of sling or induction or in the cluster of Paris hip spike. Immobilization of the hip is started after 6 weeks.
हेलो
Immobilization.
करो गया
It is rarer and occur due to the violent abduction force with thigh flexed. It occurs in road-traffic accident. The dislocated head of the femur may lie in the obturator foramen or symphysis penis. Okay, anterior dislocation is very rare and occurs due to the violent abduction force with the hip flexed, high flexed. It occurs in the road traffic accident. Dislocated head of the femur may lie at the obturator foramen or the symphysis pubis. Clinical features is localized pain, stiffness and tenderness, liability to bear weight, inability to bear weight, limb externally rotated with the apparent lengthening. Limb externally rotated with the apparent lengthening of limb. Manipulative reduction under the general anesthesia and immobilization either in the hip spica or Thomas splint for 6 to 8 weeks are done. Open reduction may become necessary when the attempted reduction fails. Central dislocation. This type of dislocation results following a fall on the greater trochanter or due to the road traffic accident. The floor of the acetabulum is fractured and the head of the femur is pushed into the pelvis.
क्यों ये यार
Clinical features: severe localized pain and stiffness, hip abduction and rotation are not restricted with the several pain and random movement of the hip joint. Body mass is palpable for rectal examination, and the limb remain in neutral rotation and short. Okay. Central mass short because another just the dislocation is reduced by
Please
retraction
like
with the
and double
pelvis
tap, please.
compression or
Like and double
pelvic
tap करो
to the two direction longitudinal long line of the leg and bilateral to the trochanter after reduction. Retraction is maintained for 6 to 8 weeks. Hip is mobilized for after 6 to 8 weeks. Full weight bearing, however, is started in about 3 months after obtaining radiograph evidence of the consolidation of the acetabular floor.
भाई ये
Physiotherapy management.
करूँगा
During immobilization, it proceeds on the same line as the described for the fracture of the neck of the femur. in order to gain control over the hip joint. Strong isometric to the gluteal hip flexors, quadriceps, hamstrings are started. At the earliest, in the patient treated with the skeletal traction, small range movement can be started by 3 weeks. Care should be taken to avoid movement which predispose to the dislocation, for example, hip adduction and internal rotation with the flexion in posterior dislocation
Like in
and
the
hip
mate.
abduction and the external rotation
तो in
in
the
the
mate.
anterior dislocation during
बाकी मेरे को
mobilization.
तो
Vigorous exercise should be initiated
बाकी
to
मेरे को
gain
तो
range of hip movement
बट
and
लाइक इन द
strengthen
मते
the
करते रहो
dislocated hip.
कितने की मेरे को थोड़ा
Mobilization
धीरे
become necessary in the patient
Yeah.
treated with the hip spica associated straight leg raise should be initiated and emphasized to gain control of the hip joint. Once
लाइक
control hip movement are regained, ambulation can be initiated by 12 weeks. The patient should be independent in ambulation by 15 to 16 weeks. I give no other weeks. Complication of posterior dislocation is sciatic injury, irreducible fracture, AVN, myocystic ossificans, and post-traumatic osteoarthritis. Common recurrent dislocation, post-traumatic osteoarthritis, femoral artery and vein, anterior and the central dislocation, sciatic nerve, thrombophlebitis, recurrent dislocation, avascular necrosis, non-linear myositis significance, and post-traumatic osteoarthritis.
हाँ मामे
Associated fractures of the sternum rarely head of the femur may occur. Head of the femur fracture injury to the sciatic nerve may occur as a result of the injury itself following the manipulative reduction. Avascular necrosis of the head of the femur, it may eventually lead to regenerative arthritis requiring total hip replacement and reduced dislocation, and all dislocation cannot be reduced by closed method or at times even by open reduction. That it then requires reconstructive surgery. Osteoarthritis of the hip, it eventually requires THR, and ectoprecalcification can occur around the hip joint after posterior dislocation. It can give rise to pain and limitation of the movement of the hip joint. Comparative features of hip dislocation. The treatment needs to be started as early as to reduce the complication. Following measures can be taken. Early reduction of dislocation will be effective in reducing the injury of the sciatic nerve. Avoid recurrent by the strengthening muscle around the hip joint. Earliest initiation of repetitive strong isometric to the gluteal muscle indirectly may help in increasing the circulation of the femoral head and the neck. Give instruction not to restore to early passive movement. Joint strengthening, stretching and massage, which may reduce the magnitude of the myositic ossification. Injuries Sudden powerful contraction of the iliac muscle can cause eversion of the lesser trochanter of the femur. This injury occurs in the sports. Treatment: rest in bed for 2 weeks with the hip in flexed position is all that is necessary. Physiotherapy management: no specific procedure is needed. A treatment program should be proceeded on the same line as described at the eversion. Fracture of the neck of the femur. There are two types of the fractures of the neck of the femur: intracapsular fracture and extracapsular fracture. These are in fact trochanteric fractures and which is intracapsular fracture of the neck of the femur. This injury commonly occurs in elderly person, particularly women. Following a travel fall, slip in the bathroom or stumble over the carpet. The femoral neck is also common site for the pathological fracture due to the deposition. The clinical features: pain, stiffness, localized tenderness. I will need Maheshwari for this. Sure, not needed right now. Orthopedic physical assessment. This is 91. Okay, Maheshwari. There are two types of the fracture of the neck of the femur, that is intracapsular and extracapsular fracture. Of course, intracapsular is more severe. As a matter of the convocation, the term fracture of the neck of the femur is used for intracapsular fracture of the neck of the femur. The extracapsular fracture is usually called the intertrochanteric fracture. The necessity of differentiating classifying these fractures is rather close proximity due to the fact that they behave differently in terms of outcome, where the fracture of the neck of the femur almost never unites. The intertrochanteric fracture unites readily. Neck of the femur is intracapsular. Other difference between these two neighbors are as they given in the table. Which table? Age is more than 50 years and 60 years. Female are more involved, male are more involved. Injuries tribal, significant. Ability to move, may walk in impacted fracture. Tenderness is present in the intertrochanteric fracture. Scarpa's angle, other intertrochanteric passage. Ecchymosis is present. Tenderness is present in both. Extra rotation deformity less than 45 degrees, more than 45 degrees. Shortening less than 1 inch shortening, more than 1 inch shortening. Treatment internal fixation always can be managed by traction. Complication non-union is the most complication non-union. Okay. Pathanatomy, most of these fractures are displaced with the distal fragment externally rotated and proximally migrated. This displacement also occurs in the intertrochanteric fracture, in which these are more marked. This is because in an intracapsular fracture, the capsule of the hip joint is attached to the distal fragment. The capsule prevents extreme rotation and the displacement of the distal fragment. Intertrochanteric fracture and the extracapsular fracture beginning outside of the attachment of the capsule, there is nothing stopping wide displacement. Okay. The classification of the neck of the femur fracture, the anatomical classification, Powell's classification, and Gardner's classification. Anatomical classification is on the basis of the anatomical location of the fracture, subcapital fracture just below the head, cervical, the fracture in the middle of the neck, subcapital, transcervical, and basal. The fracture at the base of the neck. So they divided neck into 3 parts. More approximately, the fracture is located. Approximately, the fracture is located. The worst is prognosis. So the anatomical basis, there are 3 classification of the neck of the femur fracture: subcapital, transcervical, and the basal fracture. Subcapital is the head of the fracture just below the head. Transcervical is a fracture in the middle of the neck, and the basal is the base of the neck. The proximal, the fracture is the worst. The prognosis is Powell's classification. The classification is based on the angle of inclination of the fracture in relation to the horizontal plane. Fracture line inclination per. The fracture are divided into 3 types depending on the angle: 30 degree, 50 degree, 70 degree. 30 degree horizontal line, 30 degree horizontal line, 50 degree horizontal line, 70 degree. Grade 1, 2, 3. The more unstable the fracture, the worse the prognosis. The more the angle, the more unstable the fracture. Okay. And Gardner's classification is based on the degree of the displacement of the fracture, mainly rotational displacement. The degree of displacement is just from the change in the direction of the medial trabecular stream of the neck in relation to the bony trabeculi in the weight-bearing part of the head and the corresponding part of the acetabulum. The stage 1 is fracture is incomplete with the head tilted posterior lateral direction. So there is an angle laterally at the trabecular stream. This is called the impacted or abducted fracture. Impacted or abducted fracture.
नमस्ते। मैं राइटिंग में ओपी करने वाला था, तभी तुमने नमस्ते लिख दिया। ओके, थोड़ा वो नहीं लगता है राइटिंग। नमस्ते वो नमस्ते, वेलकम, थैंक यू लाइक करने के लिए। बाकी मैं राइटिंग ओपी करने का मन लगा रहा था। नमस्ते को नमस्ते, मैं वो भी करने वाला था, कोई कॉमेडी नहीं आ रहा था। फिर मैंने तो दिमाग लगा रहा था कि कहीं मैं वीडियो ही बनाऊँ, उतने में तुम ही आ गए। ओके नमस्ते नमस्ते, क्या हाल है, कहते हो? मैं तो ठीक हूँ। तो कूल, हेलो वेलकम फॉर वेलकम। तो मैं थोड़ा सोच रहा हूँ, तो तुम्हारा नाम ठीक से नहीं बोल पाऊँगा आगे का, लेकिन पीछे का बोल रहा हूँ। ओके, पाली, पानी, पानी, पाली, आंटी, भाई, मैं ठीक, तुम ठीक हो? ओके, हेलो वेलकम वेलकम, वेलकम टू द राइट टीम। एंड मैं डायरेक्ट वेलकम कर रहा हूँ। ओके, मेरे को थोड़ा सा नाम पढ़ नहीं पाऊँगा, आई थी। भैया कहाँ पे हो? मैं गुजरात वडोदरा हूँ, गुजरात वडोदरा से हूँ। पेंसिल कलर, हाँ पेंसिल कलर है, इन कलर से बना रहा हूँ तो काफ़ी इजी पड़ता है। अब ये कलर से बना रहा हूँ, और हाँ ये कलर होता है। दिमाग लगा रहा हूँ कि यार इसका वीडियो ही बना लूँ, लाइटिंग करना देखा है, दिमाग तो ये लगा रहा हूँ। हाँ बाकी तुम कौन से कलर से बनाते हो? हाँ लेकिन इसमें टाइम ज़्यादा लगता है, पता है, इसमें टाइम तो लगता है ना, वो दिमाग का बुखार करता, खराब करता है। पेंसिल कलर सही है, मैं ये भी यूज़ करता हूँ। हाँ लेकिन उसमें कितना टाइम लगता है, वो कि थोड़ा फोकस भी अच्छा खासा रखना पड़ता है, तो तुम्हें पता है कितना रखना। देखो ये पर्पल कलर कहाँ से आ गया, ये पर्पल कलर क्यों है? पेंसिल कलर करना इतना होता है, लेकिन उसमें टाइम बहुत ज़्यादा लगता है। मैं फटाक से करने का ट्राई करूँगा। पेंसिल कलर में टाइम ज़्यादा लगता है, वही है। बाकी यूजफुल था, अच्छा खासा होता है, लेकिन टाइम और मेहनत ज़्यादा लगता है। पेंसिल कलर भी भाई, हाँ पेंसिल वेरी कलर कैसे देता हूँ, टाइम तो लगेगा बहुत, मैं बहुत बसे मैं बस मैं कलर माँ करता हूँ। ओके भैया यार, मैं भी एक बार फूट क्यों तो ले लेता हूँ। तुम क्या बोल रहे हो? क्यों तो लेना पड़ेगा। वह थोड़ा ट्राई के डबल टैप किया था। पेंसिल कलर में टाइम भी बहुत आता है। बात भी तो ये पता भी है कि देखन गुड भूल गया हूँ यहाँ पे था। गुड भूल गया। ये तो मैंने को भी पता है। मार्कर मार्कर का यूज करना थोड़ा मुश्किल है, लेकिन भैया को तो कहीं मजा आता है। अच्छा लग रहा है। नहीं, बात वो नहीं है। मार्कर मार्कर से याद आया भाई। मार्कर से कुछ याद आया मेरे को। मार्कर मेरा एक भाई मार्कर लाने वाला है मेरे मेरे लिए। तुम्हें पता है क्या भैया? एक भैया मेरे लिए मार्कर लाने वाला है। भाई मैं जा रहा हूँ, मेरे नेट खत्म हो गया। ओके बाय बाय। लाइक एंड डबल दे दिया। सब्सक्राइब कर लेना, वरना सब्सक्राइब नहीं किया तो भाई आओगे कहते। सब्सक्राइब याद से कर लेना है तो आप। बाय बाय। मेरे साथ भी काफ़ी बार हुआ है ये। नेट खत्म हो गया, नेट खत्म हो गया। पहले वो होता था मेरे साथ भी, तब मेरे पास वाईफाई नहीं था। अब नहीं होता मेरे। वाईफाई आने के बाद, मतलब वाईफाई आने के बाद ये टेंशन रहता है कि भाई लाइटिंग ज़्यादा ना करो, क्योंकि भाई वाईफाई में एक प्रॉब्लम भी है। वाईफाई में बस एक ही प्रॉब्लम है कि उसमें मोबाइल देता है, नहीं होता। ये मैं रैंडम ही बना रहा हूँ। इतना देख के कौन बनूंगा यार? इतना भी करना वो देख के नहीं बनाने वाला डिटेलिंग में हेयर को, क्योंकि मेरे को पता है कि मैं देखते देखते बनाऊंगा तो भाई ये रैंडमली भाई कुछ भी बन जाएगा और मैं बना भी नहीं पाऊंगा। इतना मैं अपने हिसाब से बना लेता हूँ। अच्छा लग रहा है, तुम्हें अच्छा लग रहा है, लेकिन मेरे को उतना भी अच्छा नहीं लगेगा। मेरे को इससे ज़्यादा अच्छा बनाना है। मेरे को जितना होता है उतना अच्छा बनाना है। वाओ, अरे थोड़ा बोरिंग लग रहा है तो मैं समझ रहा हूँ। जी तो ड्राइंग करता होगा वही भाई राइटिंग देख सकता है ना। मेरे को पता है वो क्या है। ज़्यादा से ज़्यादा वीडियो बनाने को कोशिश करना चाहिए। बनाने को सारा वो करना चाहिए लगता है। तरी चेक करने को मेरे को नहीं करना चाहिए लेकिन क्या करे, मेरे को ये करना पड़ेगा। लेकिन क्या करें।